Hey everyone, welcome to the channel. Today we're diving into something critical for all healthcare professionals: emergency hospital medications. These are life-saving drugs that can make all the difference during life-threatening situations. Whether you're working in the ER or preparing for a clinical rotation, understanding these medications is crucial. Emergency medications are drugs used to treat life-threatening conditions quickly and effectively. These are typically stored in a crash cart, which ensures that they're easily accessible when every second counts. Let's take a look at some of the most commonly used emergency medications, their dosages, and how they're administered. First up, we have atropine. This is commonly used to treat bradycardia, or slow heart rate, especially during neuromuscular blockade reversal. When heart rate drops dangerously low, atropine comes to the rescue by speeding it up. The typical dose? 1 milligram for push, and it works fast. But remember, always monitor heart rate and blood pressure while administering. Next is calcium gluconate. If you've got a patient with hyperkalemia, especially with ECG changes or potassium levels over 6.5, calcium gluconate is your go-to. The usual dose is 1 to 2 grams for over 2 to 5 minutes. If you're dealing with cardiac arrest due to low calcium or magnesium toxicity, give a more rapid dose of 1.5 to 3 grams. Keep an eye on heart rhythm and blood pressure. For fluid overload or edema, we turn to furosemide. This diuretic reduces sodium reabsorption, helping with volume overload. Start with 20 milligrams for or orally, and adjust depending on the patient's response. Be cautious though, as high doses or rapid for administration can lead to ototoxicity. Always monitor electrolytes, especially sodium and blood glucose. Then we have epinephrine, a true emergency essential. This is often used to treat anaphylaxis due to severe allergic reactions. For adults, we usually administer 0.3 to 0.5 milligrams IM. In cases of severe hypotension, epinephrine can be given via 4, but only after trying IM doses first. It's all about adjusting the dose based on how the patient responds. Now, naloxone is a lifesaver when it comes to opioid overdoses. This antidote works by reversing the effects of opioids like heroin or morphine. You can administer 0.04 to 2 milligrams for and repeat every 2 to 3 minutes if necessary. If you can't get an IV line, you can give it IM. In the case of opioid overdose, it's critical to act fast. Labetalol is an alpha-beta blocker used for hypertensive emergencies. It works by lowering both blood pressure and heart rate. The starting dose is 20 milligrams for, administered slowly over about 2 minutes. If you need more, repeat every 10 minutes, but don't go over 300 milligrams in total. Keep monitoring BP and heart rate throughout. Adenosine is used to treat paroxysmal supraventricular tachycardia. It slows down electrical conduction in the heart, particularly at the AV node. Administer 6 milligrams for over 1 to 2 seconds, followed by a normal saline flush. If the first dose isn't effective, a second dose of 12 milligrams can be given. For arrhythmias, especially ventricular tachycardia or ventricular fibrillation, amiodarone is a must-have. It helps by blocking sodium, potassium, and calcium channels, as well as beta receptors. For initial treatment, give 300 milligrams for IO push and a second dose of 150 milligrams if necessary. But remember, never give it as a rapid push. If the patient still has a pulse, this can cause severe hypotension. Norepinephrine is used in shock situations, particularly for cardiogenic and septic shock. This medication works by constricting blood vessels, raising blood pressure. Start with a dose of 0.05 to 0.15 mcg, kilogram, min 4, adjusting every 10 to 15 minutes as needed. It's best to use a central line when administering. Magnesium sulfate is a key player in treating preeclampsia, eclampsia, and Torsades de Pointes. For preeclampsia, we give a 4 to 6 gram bolus for over 15 to 30 minutes, followed by a continuous infusion. For Torsades, you'd give a 1 to 2 gram for bolus over 15 minutes. Always dilute to a 20% solution for 4 infusion. Next up, sodium bicarbonate is used to treat metabolic acidosis and hyperkalemia. For metabolic acidosis, we start with 100 mEq for over 1 to 2 minutes for a pH under 7.1. For hyperkalemia, we give 50 mEq for over 5 minutes. Just be careful with this one, as it can shift the pH balance too quickly. Dobutamine is a medication used in shock and heart failure situations. Administer 2 to 5 mcg kilogram per minute IV and adjust every few minutes based on the desired hemodynamic response. The maximum dose is 20 mcg kilogram per minute. Always use a large vein when infusing it. Dopamine is a common treatment for shock, as it supports blood pressure and heart function. For critical care, use a dose of 2 to 20 mcg kilogram per minute and adjust every 10 to 15 minutes based on response. It's usually diluted in normal saline or dextrose before use. Lastly, potassium chloride is used to treat hypokalemia. The key here is do not give it undiluted or as a rapid for push. That can lead to fatal cardiac arrest. Administer 1 mg per kilogram H4 with a maximum dose of 40 mEqH in critical care settings. Thanks for watching this video. If you found this information helpful, don't forget to like, subscribe, and share with your fellow medical students. Drop any questions or comments below, and I'll see you in the next video.